Hello, everybody. I know I've been gone for a while, so I have some news to tell you. So I was sick for a while, and I had a real stuffy nose, and then a sore throat, and I wasn't feeling good. So didn't make a video for a couple days, well, a couple weeks. So then after that, I scheduled to get my toenail removed. See, I get ingrown toenails all the time, and always getting them in my big toes. They just never go away. It just really sucks because they get infected and this, and it's just so annoying. And I've been contemplating whether or not to, you know, get part of it removed, not the whole nail, which my mom has the whole nail, which I don't know. I don't think I want the whole nail, but I just got, just the part of it done. But anyways, they do consider that a surgery, so I had that done like 2 days ago, so feeling a lot better. But it kind of sucked because they can't give you the surgery unless because they put a chemical on it, so it doesn't so they just kill the nerve where your nail grows in your foot, so you can't so the nail doesn't grow back. But you have to make sure you don't have the infection first from an ingrown toenail, because if you do, then you can't do it. Then you have to have, the whole thing done all over again. So you have to wait till it clears up, and then they might give you a pill for infection, because that happened to me. I had one during the summertime, and I was holding it off because I didn't want to go, because I hate getting the needles. The needles is like the worst part. So if you're going to be like, if you're getting, if you have to get an ingrown toenail removed, or if you're thinking about getting like the surgery done, or just getting the nail off, the needles are like the worst part, I'd say. Other than that, you really can't feel anything else. You can feel like a little bit poking and probing, but that's not that bad. The part is the worst is the one they have to put the needles in. I suggest you don't watch it on YouTube of them numbing your toe. Don't watch other videos of them putting needles in your toes. Yeah, you don't want to see that because it might freak you out, so don't want to look at that. But that's like the worst part. Anyways, like I said, I had an infection, and I didn't want to go. I was like holding off. I had it for like 3-4 months, and it never went away. I know it's probably bad. I shouldn't have an infection for like 3 months, but I didn't want to go because I was just so afraid of the pain. But I tell you what, it was definitely worth getting. Like, doctor was nice. She did it for me. She did a good job. It didn't really hurt. Well, besides the needle part, and then I had to get an X-ray done because, like I said, my infection was pretty bad the first time. Well, that's actually the second time I had the infection in the same toe, same side, because I had it once when I was in high school. Then other times I was able to clip the nail out of the skin, but then this time I got infected. So, like I said, then this time that recently, summer last year, like 6 months ago, 7-8 months ago, well, almost a year ago, that's when I went, and she did it for me, and then she was like, "Oh, come back, in December," and I went back in December, and she told me that I should probably think about maybe getting the nail like permanently off. They use this chemical, which I don't know how to say it, but they use like a chemical to kill the nerve so that it doesn't grow back. My mom got the whole nail off. I don't even know if they still do that, or if they do, if they don't, because I mentioned it, and they just, they're like, "Oh no, you don't get your whole nail off." I'm like, "Okay, that's good," because I really didn't want my whole nail off. Like, my mom had that done, and I know it's really painful compared to just getting a piece off. Like, you'll probably be sore for like, after, the Novocaine, or I think that's what it is, after that wears off in your toe, it's a little sore. You might want to take like a Tylenol or something, but other than that, it's not bad. But I hear if you get your whole nail off, you're in like a lot of pain for a couple weeks, and it sucks because it's really sore. I mean, it's sore now, but if you just took the whole nail off, that would probably, you'd be in a lot of pain for a little bit. But I mean, it would suck. You have to, then they give you, and I have like all these instructions that I have to do, for like a week, twice a day, for 7 days, 2 times a day. I have to give my toe a salt bath, and then I have to put Neosporin, and then I have to bandage it up, and that's pretty much it. And then I have to make sure it doesn't get infected, because if I do, then I'll have to go back, and I don't even want them to poke and probe and give me more needles, because last time when I had the infection, talking about the summertime, like I just mentioned, I had to get, they had to like test that and make sure I was okay, because it was infected, and it was blood and pus and all that. Yeah, icky stuff. That was not good. Like I said, you guys really shouldn't wait that long. If you do have one, I suggest you just go and get it done as soon as you can. If you notice, like, even if your nail is starting to hurt, they could just do it for you, and you wouldn't even have to, like, touch your nail and let it get that way, because I've learned the hard way, and it really sucks. And thing is, you can't, like, swim for a little bit either, so if you are going to be swimming, try to get it done, you know, prior to that, because you can't. So that's why I'd rather get it done now, because then once summer comes, I'm going to be going, like, the beach and then the pool, and it's going to be, you're like, you can't get it wet because it'll get infected, and you don't want that. So my toe is doing okay. It's a little sore still, but I'm having a problem where, like, the wrapping is coming off. Like, you have to do it really well with the gauze, otherwise it's gonna fall off, and it falls off, and then it just not good, but because it needs to stay on, because you need to stay on. But it falls off, but then I just put it back on, and then it was a little red today. So in a little bit I have to give it, like I said, twice a day you give it a salt bath. But yeah, it's a little red and a little sore. I'm just afraid it's gonna get a little bit. Hopefully it doesn't get infected. But like I said, you just got to keep up on everything, and hopefully it doesn't. So that's everything about my toe. It sucks. So if you are having an ingrown toenail, I suggest just go to your podiatrist so they could help you out. Like I said, because it sucks. They really do suck. Mine seem to, like, never go away. They always just reappear. It just really sucks. I wish, even they say, oh, if you cut your nails straight, but see, like, mine aren't even that way, because, like, I have shorter nails. I don't even have longer ones, because I know some people, like, if you Google online pictures, they have, like, their toe, like, their nail, and, like, the skin is kind of like this, like, kind of like a rainbow, or not the skin, the nail is kind of like a rainbow, and it's, like, growing into the skin like that. But mine's not like that. It's, like, deep down in the skin. It's hard to, well, maybe you know what I mean, but it's, like, in the skin, which sucks, because if your nails are short to begin with, which, I have short fingernails too, and I have short toenails too, so all my nails are really short. So they also say if you cut your nails too short, that could be it too, which I don't, I've had this problem since I was, like, 16. My mom has it, so, it's probably just hereditary. Even a lot of people just get them. They say you get them from shoes, or, cutting your nails too short, or, making them, like, not cutting them straight across. You gotta cut them with, like, the right clippings, the scissors, or the nail clippers. You have to make sure you do it right. So there's a lot of things that, benefit into it, but, the best thing to do is to just try to keep your toes, your nails in good condition. Just try to cut them right. If not, if you're always getting them like I am, then maybe you should get it done. I mean, all in all, the procedure is not terribly bad. It's like, it was weird, because, like, my initial wait, like, I was waiting so long for the doctor to come in, and I was getting so nervous. I was like, I want to leave, and I was, like, getting so nervous. I was in the chair for, like, 20 minutes, and I was, like, just wanted to get out of that chair and, like, back out of the office, because I didn't even want to be in there, like I said, to begin with, because I just didn't want to. So, like, the needles, like I said, they give you, like, 3 or 4 shots, in your toe. There's 2 different doctors at the podiatrist that I go to, because it was his practice, but then I guess he had, like, a hip replacement or something, and then she came in, which I wasn't going for a couple years, because, like I said, I didn't want to go until I had that infection. So then I made an appointment, and, I had the girl, she was nice too. And like I said, I had her, and I actually had an appointment scheduled with her, but I ended up with him. But it's okay. I mean, he still did it, and he still did my nail, and it was okay. But like I said, they'll give you 3 or 4 shots of the Novocaine in your toe. So that part is, the worst, like I said, because it kind of hurts, not going to lie. I mean, I cried the first time. I think it hurts more if you have an infection. Not going to lie, like I said, that's why if you have an infection, try to go there ASAP, because if you let it go like I did, it's going to really suck. So like I said, try to go as soon as you can, But like I said, the needle part was the worst, because, it hurts. So they give you, like, this cold spray, I guess, like they spray down in your toe when they're doing that with a needle, which I didn't look, because I was laying back and I don't want to look. I don't want to see them putting the needle in my toe. No thanks. Don't really want to see that. So, I had my fiance there. He's seen it, and Then he saw, I guess the doctor said sorry because I guess when he hit the one spot in my toe it was bleeding, but I didn't even feel it because I was like completely numb. But I did feel like poking and like probing a little bit, like cutting the nail down. I felt a little bit, but it wasn't even bad. So, like I said, they cut and I guess they were cleaning it and they put like a chemical down there, I guess. I'm not sure what it is, but it's so that, it doesn't grow back, but it's just a part of my nail. Like I'd say your nail, like, okay, my nail say is 100%. It's like maybe 75%. I wouldn't even say like that. I mean, not 70%. Like only, not even half of it is gone. It's mostly, I still have like 75% of my nail because it's not, I can't believe how small it actually is that's gone. But they say sometimes it could come back, which I hope it doesn't grow back because they say there's cases where they do. And if it does come back, that's going to be pretty unfortunate because if it does, then I guess I don't know what I'm going to do. Either get the whole nail off and yeah, I don't know even. I don't want to think about that because like I said, the initial needle part is the big part. I just, I hate. So, yeah, I think that sums up, where I've been and what's been going on, and I'll be making other videos shortly, but I'm just trying to recover from my toe, mostly all better. But if you have any questions about, ingrown toenails, an infection, anything like that, the procedure, anything, just let me know. I don't mind making a video telling you about this. Like I said, it sucks, but everything in life just, sometimes things just happen to us and we just have to go with it and hope for the best. But thanks for watching, and I'm glad, I have these nice people, you guys that love to watch my videos. I'm glad you enjoy. Sorry that I take these long breaks and, it's just, I don't have ideas for videos, and then what happens is like a couple days go by and then like I get sick. It seems like I'm always getting sick. I said my immune system is like, I feel like it's shot for some reason. I don't know. I'm always getting sick and it's just so annoying. Like my throat was so bad that I couldn't even swallow and I couldn't even talk like I am now. I still am a little bit stuffy. I feel like it's coming back again. I don't know why, and I'm just hoping it's not. But anyways, I'm dragging this video out way long than it's not supposed to be. But anyways, I hope you guys are doing well. I'll talk to you again soon. Bye. Take care.